why does therapy so often suck for men?
So there are a couple of reasons for this. The first is that I think we have a misunderstanding. Somewhere along the way, we got the impression that talking about our emotions is the best way to handle them. So I think we have a bias about our understanding of emotions. We think, first of all, they're primarily mental. Secondly, we think that talking about them is the way to go. And therapy is the best evidence-based approach that we've got, basically historically, of dealing with your emotions. But I think there are a couple of biases. The first is that the majority of therapists are women, and the majority of patients are also women, historically, which means that if you're looking at a population and you say talking about emotions really works for my patients, if you're just a therapist, we don't really segregate between our male patients and our female patients. We sort of like look at this and we say like, this is what works. Now, there are lots of trials that actually show the opposite of that. So we'll have trials on cognitive behavioral therapy that look at 50% men, 50% women. Both of them have good effect sizes. But there too, I think there's a selection bias. Because even if you're looking at success in therapy, you're not counting all the people who left.
That didn't go to therapy in the first place.
Because talking about emotions did not work for them. Yeah. There's even a really interesting paper. So there's a lot of exploration into this. And one paper actually points out that there are two kinds of therapy that you can give. One is what we call emotionally supportive therapy, where you talk about your emotions. And the second is something called instrumental support, which is like problem solving. And what we tend to find is that men prefer problem solving. But if you look at therapy training, we are actively disincentivized to problem solve with our patients. We're not there to solve your problems. So when I was like a second year psychiatry resident, and I had this 16-week therapy course where I'm learning the basics of therapy. And, you know, one of the teachers came in and was like, if a patient walks in and says, "Can you help me find a girlfriend?" What's the right answer? And then the right answer is that, help me understand why you think you can't find one. Help me understand why you want one. Let's talk about it. The answer is not yes, right? So as therapists, we're not very good as a whole profession at like helping people solve problems. And I think especially if you look at men, there's a lot of disturbing data on diseases of despair. So between, I think, like 2009 and 2018, suicide-related diagnoses in people under the age of 18 went up by 287%. So what's happening right now, especially if you look at male mental health, is we're starting to realize that there's another study, for example, that there are a couple of studies that show that somewhere between 37 and 66.7% of men who commit suicide, somewhere between 37 and 66%, have no history of mental illness. So what we're starting to realize is there's a very troubling signal that we're seeing that people who kill themselves may not be mentally ill. They may actually have a life that they've just mentally checked out on. They've looked at their situation, they've tried to fix it, and they just have nowhere to go. And we're seeing this especially as we see things like changes in our economic situation, changes in employment or underemployment. There's a lot of economic forces that are affecting men. And so now the problem is that, especially when I work with my male patients, what I see is sometimes when they come in, they'll say, okay, I feel suicidal. I have low self-esteem. Okay, I diagnosed you with depression. Tell me about your life. I'm 30 years old. I have no job. I've never been in a relationship. And so like, what would this person look forward to, right? And so a big part of helping them is not just talking about your problems. A big part is helping them build a life. And that's not something we're trained in as therapists.
Does this require an entire new type of therapy? It almost, to me, based on what I know about the definitions of therapy, almost sounds like it gets into some kind of coaching in a way.
Yes. So I think that's why coaching has emerged as a field, right? So I think that what started happening at some point is therapists stopped focusing on material outcomes for their patients. So if you look at how we judge the quality of a therapist, it's the reductions in their depression scores, anxiety scores, which I think is completely reasonable, right? That like makes sense because that's what our job is. But we certainly don't measure things like promotion or what percentage of people get married and things like that, which is if you really look at like what makes people's lives worth living, it's those kinds of achievements. And even if we look at, so the really fascinating thing is if we look at the evidence-based methods of therapy for diagnoses that are predominantly men, we see more action. So a great example of this is something called motivational interviewing. So if you look at addictions, the majority of people who have addictions are men. And if we look at what is the best evidence-based technique, maybe not best, but one very effective evidence-based technique, it's something called motivational interviewing, which is all about getting people to do shit. It's not about talking about your feelings. We're not going to examine your dreams or things like that. It's like, you have this goal. How can I interview you in a way that increases your motivation and moves to action? So we actually see that, where there are some diagnoses that are predominantly men, where the technology that we use, the therapeutic technology that we use, is action-oriented, is instrumental. And we talk about emotions and stuff, but the emotions is not the end. It's a means. How can we understand how these negative emotions are impacting your actions and preventing you from achieving what you want? So we absolutely see that signal in therapy.
I was talking to Adam Lane Smith, ex-psychotherapist, now turned sort of coach, attachment expert guy. And he was talking about the way that the male brain actually, there's a sexed difference in how it sort of moves in this linear motion between seeing something and then moving toward action, whereas the female brain works in a slightly different way. I know that MRIs are able to detect male brains and female brains at 10 years old with a 90% accuracy, which is almost exactly the same as you can detect faces, the sex of faces. So a machine is basically as good as a human when it comes to looking at either just the brain or just the face. And I think I'm pretty interested by this. It's my shiny new toy, and I'm trying not to sort of apply it to everything. But certainly when I compare my time, maybe between 1,000 and 1,500 sessions of meditation, maybe 500 to 1,000 sessions of breath work, maybe 1,500 days of journaling, something like that-ish, maybe 2,000 days of journaling. 6 months of therapy has provided me with insights that I would have never got. I didn't get at all. It identified patterns in me that I just did not have the perspective to be able to see. It showed the origins of where particular behaviors and thought loops and assumptions and neuroses about the world, where they came from, and it began to give me a timeline that helps me to understand who I am and why I behave the way that I do. Not just noticing that behavior comes up, which it also helped me to do. It's like, hey, you keep on saying this sort of thing. This is a term that keeps on being used. And the best thing that she said is pay attention to fleeting thoughts. That's the coolest thing that I've learned. And almost I wonder whether people that are very practiced meditators, what you're doing, the equanimity that you're looking for, you notice the thought arise inside of you, see, hear, feel, note it, and it sort of goes away. But by doing that, you never actually investigate, okay, where did that come from? Like, why did that particular thought? That's the 5th time I've had that thought this morning. And that's a rumination I have about myself or whatever. And it seems to me like therapy type practices help to hold on to that.
Absolutely. So many things. I love everything that you said, Chris. So let's go through a couple things. One is that going back to why, so therapy is awesome and you've had a good experience. I'm a therapist. I love doing it. I work with a lot of men and women. Let's understand a couple things. The first is that, see, when you look at meditation or journaling, you're the only one in the room. So if you just think about the people in your life, right? So how easy is it for you to know what mistakes someone in your life is making? It's so much easier to see mistakes in someone else. And so the real value of working with another person like a therapist is that they can see your problems way clearer than you are, and they have a pile of training to really tease apart with the information that you give them really what's going on. So it is not, I'm not surprised at all that you have had an overwhelmingly positive experience in a short amount of time with therapy. I also think that other people's mileage may vary because, generally speaking, the harder working you are at introspection, the more mileage you'll get out of therapy. So I think the big irony is that a lot of men who are very independent and focus on journaling and meditation and want to improve their own lives, they will get so much benefit out of therapy because they've done so much internal work, and the two really combine. And that's part of the reason why I will combine a meditative practice with therapy, because it enhances the effect size of therapy when I help people train their minds. Second thing is that I'm with you 100% that there are some things, so action orientation and instrumentally improving our lives, like that's the reason we built a coaching program. So having worked as a therapist, and I had an awesome mentor who told me about this place called the Institute of Coaching at McLean Hospital and Harvard Medical School. And he's like, you should really go check that out because I think this is the kind of work that you do. And I was like, my mind was blown away. And then I realized that what people need right now is not just talking about their feelings. I think a lot of people need therapy, but that a lot of people don't know how to accomplish their goals. And we were talking a little bit about creators, right? So like we created a creator coaching program, which has had now 500 coaches go through it. And what we discovered is that like teaching them some of these skills and helping them understand why is it that you can't afford to take a break from content creation, but you're so burnt out that your content is crap. And so like they get stuck in these cycles, and helping people understand how to actually achieve their goals, which is sort of what if you look at some of these organizations like the International Coaching Federation and stuff like that, it's all about like helping people achieve and accomplish what they want. This is why you have coaches that are employed by like Google and YouTube and stuff like that. Everyone has seen that there's a lot of value to that. The other thing that I kind of want to say, just one more point about gender, is that, so remember we said earlier that estrogen makes you more aware of your internal emotional state. And so talking about emotions is easier for women, but potentially because of estrogen. And there are even studies that show that the reason that men are reluctant to go to couples counseling is because they feel outgunned. So anytime
it's
a man...
an unfair fight.
Absolutely, because your female, assuming a heteronormative relationship, your female partner knows how to articulate their emotions. They know what they're feeling, right? I feel saddened when this person does this because it makes me feel unloved. And then female therapist 70% of the time is also like, so they both speak the language. Mm-hmm. It's like going on
two adults in the room with one child.
Yeah. And so what it feels like to men, what one person told me is when I go to couples counseling, it feels like I'm playing basketball, but I have no arms and I can't dribble. So they can't participate. And there's studies on this, which show that men can't participate in that way in therapy.